Hello, I'm Sheila Malloy, and I'm a former patient at the mental health wing. And I was really excited to take part in this Kaizen week. As a former patient, I wanted to see the length of my stay reduced, and I wanted to be able to further develop a therapeutic relationship with my nurse practitioner. And I really felt that the work that we did here this week made sure that's going to happen. In the 3 weeks prior to our event week, we had solicited input from the field staff, nursing, and other staff on the ward, and the kinds of things that they told us they felt were problematic, we also identified, and those three things were the fact that medication the medication area was congested, and there was a lot of time waiting nurses for their turn to take medications. We also had a problem with the amount of charting that was having to be done, and there was also a desire for more direct patient involvement, more time to spend with patients. So I really know that this kind of thing was addressed. Thank you.
Hi, I'm Diane Turnbull, and I'm going to just take you through the steps of the post-Kaizen. This diagram up here just shows pre-Kaizen. Our unit, it has 2 wings. Each wing has 25 patients. Each wing has 5 staff for those 25 patients, so the ratio is 5 to 1. What we did was on the east wing, we did a trial run. We pulled one of the floor nurses into the med nurse role and divided her group of 5 patients to the existing four nurses that were left. So that's what that is showing on that diagram right there. We also have SCM boards out in the public area, and that's what this one is showing. Pre-Kaizen, I think, yeah, that shows there's a 5-patient caseload. And that's in, like I say, in the public area where the patients have access to that information, as well as if family members come and they want to speak to the patient's nurse, that information's right there as well. This is the post-Kaizen, same board, just with the groups divided into 6-patient workload. This board is actually just a staff work board that we have in our staff room, just a reminder of the new system, and has identifying the medication nurse each shift of the days and evenings. And as you noticed in other pages here, or pictures, the paper volume was incredible. And we had, on the left, we had all the forms there that were used before Kaizen, and now we've gone, and those are the ones that we've eliminated now. So after we went up and totally rattled our co-workers' world and realigned all the format, we went up again and did some time observations and collected some data for the post-Kaizen data, and just followed the primary care nurse around without having to do the direct patient med dispensement. And you'll notice on this one as well, there's still the charting and the station work, as well as the wait time. Yeah, there's still a length of time there, but that again, like I say, it was a trial run, and there's still some educating to do to the staff that'll probably decrease that time over time. And our after, this is one nurse's pattern in the 4-hour block from 7 to 11 in the morning, same time frame as the pre-Kaizen. So they pivot from the med nurse room and the staff room, and the pre-Kaizen was 1,500 steps, and it went down to 969. And this form again, the red 3 there is the medication area, and it's totally eliminated that time frame for the primary nurse, and that was approximately an hour within that 4-hour period. And the number 4 item there is, again, significantly reduced, almost to half. And of course, those times that were saved are freeing the nurse up to be with the patients, to help them to be more proactive also in their own care. This is a blueprint of the East Wing, and as you noticed on the film there, our med rooms are very small, very limited space for the Pyxis machine, very crowded, congested. We did not move them for the trial, but we are going to be moving them into a more central location, which will remove the med nurse totally from the daily activities, as well as have the patients be proactive to come to the med nurse in their area to get their medications.
The 5S, or the sort, simplify, sweep, standardize, and sustain part of the process took place in week -5. The team looked at the clean service room. The pre-5S evaluation score was 2.4 out of 5, and the post-evaluation score was 4 out of 5. Before, the room was not, supplies in the room were not color-coded or alphabetized. The team color-coded supplies and placed them in alphabetical order within their grouping. So, for example, hygiene items are black, respiratory are blue, etc. This achieves the goal of everything has a place and is clean and ready to go. Based on the mental health recovery model, which encourages patients to be responsible for themselves, patient belonging bins that were located in the clean service room are now located in the patient's own rooms. This saves patient and staff time looking for and retrieving supplies and enhances the patient's dignity and recovery by taking responsibility for their own things.
So we accomplished lots of stuff over the last week, but we do have a newspaper that we're going to hand off to the process owners. There's just a few things on there that we need completed. One will be the moving of the Pyxis machine. Another will be the utilization of the whiteboards in the patient room, and then the rollout of the training related to the new medication med nurse model and the new charting. So those are well underway. I think that'll be great. I want to take a couple minutes to talk about our targets. I think we did awesome. We reduced space by 50%, inventory by 50%, walking distance by a significant amount, the elimination of the forms and the amount of paper is huge, and that has related to additional direct patient care. So really, really impressed with that. One of the things that we can't yet measure is the length of stay. So we will be following up on that to see if the length of stay has decreased as a result of this work, but there's many other really visible improvements that we have on this target sheet, so that's great. Moving on to the workshop summary. The supply room is great. That new care plan is really going to help the patient and the discharge of the patient earlier. So I think there's some really good work that's done in there, and it increases the patient care and the self-recovery model. The implementation of the med nurse, improved information for the weekly round meetings, more direct time with patient care, and clearly the patient is more involved. So some thank yous. I would like to thank Leanne Carr. She did a fabulous job with getting us tons of data to analyze. Thank you. She was really quick with that. Our sponsors were great and available for us lots. Thanks to Lori and Dr. Nat. The process owners were always there too. Stacy, Sue, and Dr. Kumar. The staff on 1D East and 1D West, they were great. What an enthusiastic bunch. More than 50 ideas. So lots of the ideas that we implemented were theirs. We just got the fun of implementing them. So that was fabulous. IT set up a room really quick. We did a little bit of work with a sub-team prior to our RPIW week so that we could really simulate it. So there was some time spent on that. And our content experts and our patient representatives. Thank you so much. You guys your perspective was awesome. We appreciated everything you did. Thank you so much for being part of this week. Glenda was always 2 steps ahead of me. Thank you so much. And Sensei Shuno. Sensei Shuno was fabulous. He told us at the beginning of the week Kaizen was fun, and I think there was maybe a little bit of nervousness, but I think we all agree Kaizen's fun? Yeah. So this team was fabulous. I had a great week. Thank you so much to everybody.